admitted yesterday. And then tomorrow, the brain biopsy is going down. Right now, I do not feel good whatsoever. I literally just drank a bottle of water and I threw all that up. I'm not gonna show you the throw up, but there's the bag. I threw up everything. Like, my stomach does not want to hold any liquids or any food down, and it's just so annoying because I have not eaten all day. And I'm scared to eat. I don't want to eat because I was like, if I eat, I'm going to throw up and it's just gonna mess up my throat even more. Since yesterday morning, I've been throwing up like acid and my throat burns, and that too much acid made the lining of my throat start to bleed. So whenever I'll throw up, blood will come out. So I got admitted to the hospital. Ooh, I'm so tired. Anyways, one of my surgeons came and talked to me and told me what's going down tomorrow at 6 o'clock in the morning. My biopsy will be starting, and yeah, I'm gonna be deep asleep under anesthesia. So it turns out in surgery you can't have nothing on, even your underwears. That's why I'm just like kind of shocked right now, like what? Because I remember in my neck biopsy I had my underwears on, but like no bra, nothing like that. I had a gown and everything, but they're like, yeah, but if the surgery's longer, they tend to like not make you wear anything under your gown. So I was like, okay, interesting. But yeah, in like a couple minutes the surgery's gonna start. Like I said, I just want to get this over with so I can go to sleep and knock out. But yeah. Now I'm on these like muscle contraction thingies. I don't know what exactly they're called, but it makes your muscles vibrate. So like when you're laying down too much, your muscles won't go weak. This will like make them move. Hello guys, I'm done and got out of surgery. How long did it last, Mom? 3 hours? My head is killing me. I feel so weird. And look, I found a new interesting place to get poked at. I never thought I'd get poked here. But I got poked this side, and then I got poked here on this side. This one hurt. I feel the burning right now. And then I got a breathing tube in my throat, and when I woke up my throat was hurting, it was dry. So I'm good and ready to go. I'm done with my brain biopsy. Now my brain just feels weird and I'm tired. I forgot what else I was gonna say. Also, I'm in a pamper for the second time. The first time was when I got a biopsy of my neck. I peed myself when I woke up, and then my mom had to put a pamper on me. This time the nurses put a pamper on me. But once I'm done here, they're gonna move me to a different room, and then... Mom, am I staying here overnight?
Yeah.
I think I'm staying here overnight. And then my head really hurts. And I'm scared to lay down this side. I don't want to lay on top of my scar. So that's why I'm facing this side. And my throat is so parched. I'm so thirsty. But I don't want to pee in my Pampers, so I don't want to drink nothing right now. Because now I know how babies feel when they're crying and fuzzy at night, because Pampers feel very uncomfortable. But anyways, let's see. I forgot what to say next. Mom, show them my scar. If you could show them my scar. I don't even know how it looks like. And then they cut like a circle of my skull, I think, so I don't know what they did. But this IV burns kinda. They'll take them off later. Put me to a different room, and I'm gonna stay here overnight. I'm recording, Mom, from my YouTube channel.
Are you sure?
You think? I hit the record button. I feel better. It's been like an hour. I don't know if I mentioned this, but they took out everything. They didn't take out a piece of it. They took out like the whole 2 centimeters mass. Because if they were to take out like a little piece, I would have been getting radiation to get rid of it. So they just took out the whole mass. And I asked them, I was like, could y'all show me how the mass looks like? Like, have you seen Dr. Pimple where she takes out your sac and then she shows you how it looks like and then she shows you your pimple and all that stuff? I told them if they could take a picture of it and send it to me. And I found something in my head. I found something else. What the heck is this? Ew. Yeah, I don't know what that is, but I have stuff all over my damn head. I need to take a shower. But anyways, I think they took a picture of my mass that was in my brain. Like when they took the piece out, I think they took a picture of it. And I told them if they could show me it. So later on, I think they'll show me it. I really want to see it. What the heck? I have a lot of this. But my mom said this is like when they screw down my head. I don't know. But yeah, I gotta go. Also, when they opened up my skull, they screwed in with like this special type of, I wouldn't say metal, it's like titanium. I don't even know. Right? They screwed it in with like plastic or...
I don't know what they screwed it in with.
Cause I know I don't have plastic. Like they just cut open my skull, then they just placed it back, and then they put like titanium or something like that. I don't remember, but they put like this special type of thing, so like it allows me to go through airports without setting off like the metal detective and all that stuff. So I'm good to go. Just finished getting my MRI. My face is all swollen, and then my mom got me McDonald's. I got cookies. Mom, look how swollen my face is, Mom.
Earlier was must.
I'm so tired. And then my head hurts right here so bad. It is Friday, August 28th. It's already been a week since my brain biopsy. And I'm here at the hospital just for a doctor's visit for blood work. I got a new interesting spot to get poked at, like literally right there in the side of my hand where you see the heart. I got poked there. They poked me lower there, like in my, I don't know what this is called. They poked me there, but no blood wanted to come out, so they had to poke me here. So I was panicking because it took forever because no blood wanted to come out. And then the nurse would keep on moving the needle. It did not so much that it hurt, but the fact that it just took forever for blood to come out, I started panicking, and I was like, no, this, I was like, could you please hurry up? But anyways, I just came. I'm here in the bathroom, and it's just a checkup today. Well, I don't know if they're gonna tell me what kind of mass they found, but it's just blood work today. And I am so tired, and it is a beautiful day outside today. It is Tuesday, September 1st, I think so. And I am just got back home from the hospital, eating tres leches. I am trying to process everything because tomorrow the bone marrow biopsy and like this spinal tap puncture thing is going to happen. And I'm just like, okay. And then they said that I might be starting chemo also. So I was like, chemo again? I was like, my Tarzan hair is going to fall off. I was like, no, I'm starting to dig the look. But yeah, I got tested today for the virus for the 5th time. Now I guess they're like testing you every time you have to get like surgery or get checked or stuff like that. So I'm like, okay. And yeah, I'm gonna be knocked out whenever I get poked in my bones. But when I wake up, it should be like, I shouldn't feel anything. I don't think so, because the last time I got this done, it was when I was getting my neck biopsy, and then when I woke up, I didn't feel anything. Like, I saw marks, I was like, ooh. But other than that, it should be good. But chemo, on the other hand, I was like, again. I'm starting to remember, like, all the times I was like, all that's gonna come back. Like, the nauseous, the vomiting, the losing weight again. So I'm like, okay. But anyways, I'm ready for that. Tomorrow's gonna be a big day. Hopefully everything goes smooth. It's Wednesday, September 2nd. I just got home from the hospital. We did a spinal puncture, which they ended up putting chemo through there, like chemo through my spine, and I did not know that. I was like, that's interesting. I was like, getting chemo through the spine? Okay, well, anyways, I got that, and then I got the bone marrow biopsy where they punctured both sides of my bones. And it was quick. It was just like an in and out thing, and I got x-rays of my chest too. And then I found out that starting Sunday, I'm gonna start chemo, and this time the chemo is gonna last like a week, like a whole week, admitted at the hospital instead of like 3 days. Like, it used to be like 3 days every other week. Now it's a week every other week, and I'm just like, okay, being in the hospital all week is going to be a lot. I couldn't even handle 3 days. Like, I wanted to leave the first night. But yeah, they ended up telling me what type of cancer I had. I do not remember the top of my head, but I'll leave it there. I'll type it. And it's like a type of Hodgkin's, but like it's rare and unusual to get like Hodgkin's lymphoma like in the brain area. So they're like, this is much more aggressive, and they want to start treatment right away. And that's what's gonna happen. I forgot what else I was gonna say. Oh, the chemo is gonna be a whole other 6 months again. I'm not gonna get radiation. This time it's just chemo. And yeah, I think that's pretty much it. It's Thursday, September 3rd, and I just finished my echo, a heart echo. This movie is so interesting. I was watching it and I'm so upset that I can't finish it. But right now we're on our way to go get an EKG. So I just finished getting my EKG, and we're on our way to where?
Fifth floor.
Another appointment. I don't know what other appointment. Right now I just got tested for my eyes. See, because lately I've been seeing lights, like dots out of nowhere. They'll just come out of nowhere. But hopefully this is the last appointment for today, and then tomorrow we have to come back and have our other appointments we have. Oh my god, too much coming to this hospital. It's like I live here, and starting Sunday we're gonna come back and chemo, and I'm like, It is Friday, September 4th. We just got blood work done. I got poked. There was literally 10 tubes, right, Mom? 10 tubes of blood. I was like, oh. Anyways, we're just here waiting for a room because it's packed right now for some reason. Oh my god, my hair. Anyways, right now we're in a room because in a while right now I'm just waiting for my orders to come in, because I'm gonna get like a bag of this like chemo antibiotic thing. I don't know, but it's one of my chemo treatments, and we're gonna be here for like 5 hours. It's gonna last forever. So we're done, and we're finally heading home, and that's it for today. It was just a very long day today. That chemo bag was literally like 5 hours running, and